Hello, this is Beth Himmelsbach. The topic of my final innovation project is computer-assisted physician documentation. The problem I identified is that the hospital receives too many insurance denials. Certain diagnoses can increase the severity of the patient's DRG or diagnosis-related group, such as encephalopathy, acute renal failure, and malnutrition. These are some of the diagnoses the insurance companies do not want to see on a claim, and almost always claims that contain one of these diagnoses will be denied. The common reason insurance auditors give for why they deny an insurance claim is due to lack of clinical evidence and validation. It is my job to find every bit of evidence in the patient's record to support these diagnoses. The mere fact that the diagnosis is written in the patient's medical record is no longer good enough for insurance auditors. The auditors have to see clinical indicators as well. There are consequences of unsupported physician documentation. Hospitals may have to return hundreds of thousands of dollars if they cannot successfully appeal the denial. If the insurance company refuses to reimburse the hospital for a diagnosis they feel is unsupported, the patient may have to pay the bill out of pocket. Incorrect coding could lead to fraudulent claims. Even if not intentional, recurring incorrect billing for a higher paying procedure or diagnosis due to lack of clinical evidence can lead to penalties, including being charged with a criminal offense. Hospital employees are spending too much time appealing denials. Quality of information in medical records is poor. Incorrect diagnoses have the ability to stay with the patient for many years thanks to the EHR. I performed a Google patent search and was amazed to find the computer-assisted physician documentation program. Clintegrity by Nuance is a cloud-based system that is compatible with any electronic health record. If a note is incomplete, the program recognizes this and provides immediate feedback to alert the physician that additional documentation is needed. Fluency Direct by M-Modal is a program that can be integrated with Epic's Note Reader feature and can give physicians real-time feedback on missing or inconsistent documentation, and gives physicians suggestions on possible actions to improve the quality of the documentation. I narrowed my research results to 3 possible solutions: enhance our current procedure, physician advisor review pre-bill, computer-assisted physician documentation, or CAPD. Enhance our current procedure. Currently, if the insurance company refuses to accept our appeals, I log the details of the denial into a spreadsheet, including the DRG the insurance company refused to reimburse us for and why. To enhance our current procedure, the information we receive from the insurance companies is valuable and needs to be shared with an interdisciplinary team consisting of clinical coders, physicians, CDI, patient financial services, and compliance. This group will meet monthly to discuss exactly what information needs to be documented in order to clinically support a diagnosis. Physician advisor review pre-bill. Weekly, we will select high-risk claims that contain a possible red flag for auditors. We will have a physician from each specialty involved in these high-risk claims review the claim's medical records. This group of physicians will be given details for what indicators are needed to support each diagnosis and procedure. The physicians can then educate their peers and have the ability to successfully obtain physician buy-in when it comes to clinical validation. Finally, computer-assisted physician documentation. The CAPD assists physicians in documenting real-time to provide quality clinical notes that support diagnoses. CAPD utilizes coding guidelines, medical protocols, and quality and clinical indicators to justify medical necessity. CAPD has the ability to analyze the physician's documentation and provide feedback in real time so the physician can add the additional documentation needed before the claim goes out the door. Additional hardware or software is not needed since the program is cloud-based. Computer-assisted physician documentation is my innovation choice. CAPD will affect cost of healthcare. The CAPD can improve the hospital's cash flow since claims will no longer need to be held due to missing documentation or waiting for retrospective physician query responses. More complete and accurate documentation will improve hospital revenue since we won't have to repay insurance companies money due to incomplete or unsupported diagnoses. Coders, physicians, and compliance analysts will no longer have to spend countless hours doing unproductive rework in order to validate unsupported diagnoses. CAPD will affect access of healthcare. It will create a high-quality medical record which will improve the ability to manage population health and function successfully in an accountable care organization and shared payment models. CAPD will affect quality of healthcare. It allows physicians to communicate more effectively with other consultants regarding their patients. CAPD will provide more accurate quality reporting. We will be able to ensure that our severity of illness reports are accurate. Correctly capturing all diagnoses at the beginning of a patient's stay enables the physician to document the patient's principal diagnosis right from the start and ensures appropriate treatment and care right away to shorten the patient's length of stay. Resources that are needed to implement CAPD. There are two popular CAPDs currently on the market, Clintegrity and Fluency. I would have to request proposals from each company and present the proposals to the finance department for approval. Once a product is chosen, of course, it will need to be paid for, so money will be a needed resource. Again, since these programs are cloud-based, the hospital will not have to purchase new hardware. In addition, each product claims to be able to integrate successfully with our Epic EHR. Training will have to be provided to the users of the system, including physicians and other healthcare providers. Hopefully, the CAPD will someday be implemented at Lancaster General. Thank you.